What is Lewy body dementia? How common is it in the United States?
We think about 1 million people are affected with Lewy body dementia. What's more confusing is we think that it's an umbrella term. Lewy body diseases, an umbrella term for both Lewy body dementia as well as Parkinson's disease with dementia. But what's unique about Lewy body dementia is that in addition to the dementia symptoms, so you have to have symptoms such as changes in your thinking, difficulties with visual spatial problems, you may or may not have short-term memory deficits.
So what is characteristic about Lewy bodies? Is there a certain, how can you tell the difference between Alzheimer's and Lewy body dementia? What do you see that makes you say, I wonder if this is not Lewy body dementia?
Well, there's one key thing, and that is fluctuations in attention and concentration. And you might say, what does that mean? It means that someone might have a good day one day and then a really bad day the next, or even changes in mood and behavior and thinking within the day. Alzheimer's disease, typically, folks are doing really well throughout the day and maybe have some evening confusions, but you don't have these rapid up and downs.
So that might make people miss the disease. If there's ups and downs, they look forward to the good and pass over the bad?
I think sometimes when loved ones, especially a spouse, sees the good day, they think that maybe perhaps they're seeing too much on the bad days. But other really big clues is that you can have a Parkinsonism, and what that means is that you have things that are similar to Parkinson's disease, like a tremor, but not always. You have changes in gait. Individuals tend to have a shuffling gait.
Just sort of walk in a shuffle. Do they fall easily?
Yes, increased falls, and so that also can distinguish Lewy body disease from other dementias, is that there tends to be early falls.
Muscle rigidity?
Yes, their muscles can be very stiff, so many times instead of having tremors, you have these other changes with what we call axial rigidity, a fancy way of saying your trunk is very stiff when you're walking.
But so you begin to pick up these things when you see somebody walk and talk, and when you interview them, you can begin to organize your thinking about what type of dementia is going on?
Yes, but I think there's another key feature that we look for in Lewy body disease, and that is visual hallucinations. It's pretty unique to Lewy body disease. It can occur in other dementias, but it occurs early. Sometimes you see something that's not there. Earlier on, sometimes you have a misperception, like you saw something out of the corner of your eye, so it's not quite clear that you had an overt hallucination.
Do they act out their hallucinations where they see things? Do they sometimes, I know I saw that person, or I know I saw that whatever it was?
Yes, individuals can also have delusions or psychoses, like a belief that they saw something. We also see changes in sleep, so sometimes nightmares become lifelike.